Hi, I'm Dr. Mike Mihailovich, Executive Director of Caravel Counseling and Diagnostic Services. I've been with Caravel for over 10 years now as a clinical and developmental psychologist. Currently, I lead a group of doctors whose primary focus is on the evaluation and diagnosis of autism spectrum disorder. At Caravel Counseling and Diagnostic Services, our evaluation process is entirely via telehealth. The telehealth appointment takes place over 3 stages: a diagnostic interview with the parent or caregiver, a structured observation with the child, and then finally an interactive feedback with the parent or caregiver. Depending on a child's insurance, these 3 stages can occur in one session. During the diagnostic interview, the doctor will ask the parent or caregiver multiple questions around a child's history, including family history, as well as their symptom presentation and current behaviors. During the structured observation, the parent acts as an assistant for the doctor who is directing the parent or caregiver to engage the child in a number of different activities so the doctor can observe how the child responds or interacts during those activities. Lastly, once the doctor has the information from both the interview and that structured observation, he or she is able to provide immediate feedback to the parents and caregivers regarding their child's diagnosis and treatment needs. Caravel Counseling and Diagnostic Services is not alone in their use of telehealth for the diagnosis of autism spectrum disorder. Boston and Seattle Children's also utilize telehealth, as well as Vanderbilt University and UC Davis in California. Nationally, children have to wait an average of 4 to 12 months to get an appointment for an autism spectrum disorder evaluation. This wait time is too long. And at Caravel Counseling and Diagnostic Services, we believe in quality and access above all else. By utilizing telehealth, we're able to shrink that wait time significantly, and we are able to see children in as little as 30 days. Oftentimes, children with autism spectrum disorder or developmental delays struggle with transitions, new environments, and new people. By allowing a child to remain in the comfort of his or her own home for the duration of the evaluation, surrounded by familiar people, objects, toys, their behavior is much more natural, and the doctor is able to get a more accurate picture of the child's presentation. There are high levels of agreement between evaluations for autism spectrum disorder completed in person versus via telehealth. Current and ongoing research shows that agreement to be around 90%. Additionally, provider and parent caregiver satisfaction is also very high with a telehealth evaluation, well within the 90th percentile. If you've been referred for a diagnostic evaluation, please contact us and we will get you scheduled with one of our doctors as soon as possible.